Obstetric fistula is one of the major reproductive challenges faced by women after delivery. The number of patients keep increasing amidst limited resources. Today, Ministry of Health has opted to partner with parliamentarians to sensitize the public about the disease so that women are able to address the scourge.
Or between the vagina and the rectum. And most times it's caused by difficult labors when the head of the child cannot pass through the bony part of the pelvis.
Over 2 million women worldwide live with untreated fistula, mainly in sub-Saharan Africa, with Uganda having an estimate of 200,000 fistula cases. Most fistula victims have often had high chances of death during childbirth, but survive narrowly, and 95% of babies born from such women usually die. More than half of the women affected are those between the age of 14 to 15 years. These mothers are too young, and their reproductive system is too vulnerable to damage.
Women who have failed to deliver, we have a few cases due to trauma, injuries during wartime, time during sex, time during rape and so on. We also have cases which come after infections, infections like tuberculosis, like HIV. Some few patients get fistula as a complication.
Therefore, the Ministry of Health, together with key stakeholders, introduced district health fistula camps to decentralize treatment to the victims.
We would like Ministry of Health to see to it that whereas members of Parliament, we advocate, we allocate resources, these resources should trickle down to the grassroots person.
Under the camp initiative, about 1,247 repairs have been done, but still the rate of infections is still a challenge. Meanwhile, members of Parliament claim that the Ministry of Health is not transparent enough to show accountability for resource allocations.
Women come up in big numbers, and if you look at the distance between a particular district to the regional or referral hospitals, it's quite long, the distance is long. So that means that you, the MP who was mobilized, women will ask you for transport, you have got to organize their transport.
When you don't inform the people that this is free, and also inform the nurses, as you visit these health facilities, inform them we have had this, if I get anyone selling the mama kits, then action should be taken.
Obstetric fistula is an injury of childbearing that has been relatively neglected, despite the devastating impact it has on the lives of girls and women. The Ministry of Health still faces a number of challenges to handle the cases. These range from inadequate funding for fistula activities and few human resources. There are only 23 fistula surgeons in Uganda, but prone to brain drain because of poor pay. Zahra Namuli, Walugembe Josephat, NBS Television.